Today we are diving into the important topic, and that is often not spoken about, and it does not get enough attention that it needs. So pancreas health.
Yes.
So to help us understand the vital organ and what we can do to keep it healthy, we have Dr. Ashish Saharia, MD, and Dr. Diana Appou, NP. Welcome to Chai Time.
Thank you. Thank you for having us.
Thank you for being here with us. Do you guys want to tell the listeners a little bit about yourself?
Yes, my name is Diana Appou. I'm a nurse practitioner at Houston Methodist Hospital. I've had a background in respiratory care, medical oncology. I've also done, of course, RN before becoming a nurse practitioner, practice on the ICU units and also regular med-surg floors. So I've had a vast majority of, experiences around the medical arena. Yes,
okay.
Yes.
And Dr. Sharon?
My name is Ashish Saharia. I'm a hepatobiliary and transplant surgeon, which generally means that I do livers, pancreas, and bile duct surgeries, and I also do liver transplants.
Wow.
So that's my day job.
Oh, wow.
Yeah.
Night job is being super dad.
I don't know super dad or not, but try to be one.
Yes. It's like a commercial. At nighttime I turn into super dad. In the daytime I see. No.
I was working last night, so I could say I could.
Super doctor, super dad.
Yeah. All of the above. Love it. So let's start with the basics.
Yes.
Can you briefly explain to us what pancreas does in our body and why is it important to our health?
Okay, so the pancreas is a gland, probably behind the stomach. It aids in digestion and also regulation of insulin in the body, or hormones in the body, should I say. So digestive enzymes and also the regulation of blood sugar levels in the body. Basically, it secretes amylase, lipase, and protease. I think you guys may or may not have heard of that. Nope. Protease breaks down proteins. Amylase breaks down carbohydrates. Lipase breaks down fats. So the pancreas secretes those. In addition to secretion of insulin, which lowers blood sugar, and glucagon, which picks up blood sugar. So those are kind of like the functions of the pancreas. Okay. So it's really good. That's its function, aiding in digestion and also blood sugar regulation in the body.
It does important things.
Yes, very important parts.
Definitely need to keep that healthy, because if you're trying to...
Yes.
Weight?
Yes.
Yeah. I was going to say if you're trying to lose weight. But
absolutely.
I'm sure that...
It plays a part. Absolutely. Yes.
Okay. So why is it important to maintain, well, we just discussed this. Why is it important to maintain a healthy pancreas?
So again, proper digestion is also good for the body, right? So you don't become, you don't have malabsorption in the body. Of course, blood sugar levels, we know it affects weight gain, up and down, the yo-yo effect of, especially in women, and it's, hormone regulation. So we need to pay attention to that. I'll also say diabetes is one of the things that really stands out. Everybody's heard of it, but we don't really know how it affects. And pancreas health can directly affect diabetes.
Really?
And like I said, malabsorption, and also not keeping an eye on the pancreas could also develop into other things could develop, and most threatening being pancreas cancer, which we've heard of, has a very low high mortality rate. So we need to, keep an eye on that.
Oh, wow.
Yes.
Okay. And what are some common conditions that affects the pancreas?
Common conditions that affect the pancreas. I would say chronic and acute pancreatitis.
Okay.
Which is inflammation of the pancreas, per se. Diabetes, which we've talked about. Type 1 being inability to produce the insulin, and type 2 being low production of insulin to break down food, and low blood sugar levels in the body. Pancreatic cancer, which is, a development of any kind of bad cells, to put it short, bad cells in the body that develops into cancer. And also pancreas cysts, which we specialize in, is a collection of fluid in the sac in the pancreas, for the most part. Yes.
Wow. We don't realize, when you're younger, right? Like you're thinking, okay, you know what? I'm healthy, I'm invincible, nothing's gonna happen to me. And the older that you get, like you start developing all kinds of
Small
things,
things.
like not sleeping properly, to poor digestion, to poor, like you're working out and you're tired. There's just so many different things that come about, and you don't pay attention to those things. But the older you get, you're like, oh, wait a minute.
Yes, it starts
like,
affecting you
something's going
more.
on. Yeah.
Yes. I think when you're younger, your body has the ability to more than likely compensate much better or heal itself much better because you're young. Your cells regenerate faster.
Yeah.
You recover faster from all the things that you go through, really.
Yeah.
And then as you get older, that tends to slow down. And then a lot of those things could potentially become disease processes when you don't take care of yourself. So, yes.
So how can we maintain an overall pancreatic health?
I would say diet would be
Yeah.
the most important thing. So eating pretty much a low-fat diet, balanced diet, good for everything, right? Working out.
Yeah.
That could definitely, help reduce body fat and, help with that. I would say not smoking. Okay. Smoking does cause, people who smoke have a predisposition to pancreatic cancer because most cancers, smoking does affect most cancers, should I say.
Yeah.
And also, I would say,
Alcohol.
Alcohol, definitely alcohol, yes, causes pancreatitis, acute and chronic. So chronic use of alcohol causes acute and then eventually chronic pancreatitis, which affects the pancreas. Yes.
I hope these young folks out there are listening to all of this.
Yeah, no binge drinking.
Yeah, exactly.
That's what I tell my
No binge.
daughter and my son. You guys can drink, but just be very careful.
No
It's
binge
hard
drinking.
to tell the kids not to drink.
Not to
Oh,
drink.
yeah, no one's going to
But
listen.
but I think what is more important is the awareness that you can drink, but remember, these are not benign things. You can have fun, but very limited amount of drinks. In fact, they've done studies now, and I've actually reduced my alcohol to almost zero for that
wow.
reason. Is because they've done studies and they've done longevity studies, and they found that those people who drink alcohol on a regular basis, their lifespan actually goes down. They used to talk about alcohol and heart, it's being good for heart and whatnot. I think some minimal amount, and maybe it's just the red wine.
They would say wine, yeah.
But
it's not always
I think long-term longevity
Yes.
goes down when you drink.
It doesn't mean drink a bottle of wine every day. It's what, so
Yeah.
those are some of the things that we need to consider. Binge drinking definitely puts the pancreas under stress
Yeah.
to release a whole lot of insulin and other, digestive enzymes to lower blood sugar. Alcohol
So
breaks
what-
down to sugar, so
Right.
we have to be careful about that. Yes.
So what would you say to people that are saying, well, I only do it on the weekends, or I only do it once a while? What would your answer to be to that?
I would say the binging part is
Yeah.
the
So if you drink-
the issue.
Yeah, if you're drinking on the weekend, but you're drinking
A whole
6
lot.
bottles of beer, that's not good. no binge drinking.
Yeah.
'Cause binge drinking is equally bad.
I just thought of
Yeah.
this one incident that happened to me. I just want to share it. I
Yeah.
gone to the doctors once, and there was just a general question asking, "Do you drink?" And I said, "Yeah, socially." And he's like, "How social are you?" It was just funny that
Going to parties
yeah.
every
it depends how
What
social
is
you are, and
socially?
how often you're going out and drinking. That
Yeah.
does matter, I'm sure.
But also
Yeah.
there's statistics
That's
on women drinking and men drinking. So and this is just the biology of humans, the women metabolize alcohol a little slower, so the problems that can arise in women with alcohol starts with lesser amount of alcohol than men. That's how the metabolism is. So women, when they talk about what is your limit, it's lower for women than men in general.
Wow, that's interesting.
Yeah.
So earlier in our conversation, you did say something about pancreatic cyst.
Mm-hmm.
So why should we be concerned with that?
Well, pancreatitis is first and foremost, it's like a fluid-filled sac that's in the pancreas. A lot of them can be benign, but as some of them can be, cancerous. As it begins to grow, we kind of need to keep an eye on it. If you have a small cyst, we keep an eye on it. That way it doesn't grow or become cancerous. So recognizing it, knowing what it is, and also keeping an eye on it is what we should be doing or should be looking to do. Yes.
Okay.
Mm-hmm.
Oh, wow.
Yes.
Never knew you can have a cyst in your pancreas.
Yes.
You
Yes.
can have cysts anywhere in any of the body parts. But certain pancreatic cysts have a tendency to turn malignant. And that is what you have to look out for. And that is what Diana has started, is a pancreatic cyst clinic at Methodist Hospital. So what happens is that, I have stories. I have a story of this guy who had prostate cancer, and he was getting routine scans done. And there was a cyst in his pancreas 5 years ago. And, screening done. No one really talked to him about the pancreatic cyst because, it's just a cyst, fluid-filled. 5 years later, he had inoperable pancreatic cancer. And we could trace it all the way back. Nobody thought of sending the person to somebody who needed
like a specialist.
Specific pancreas care. Actually, honestly, there isn't any system that can do it. I mean, unless you recognize, okay, well, somebody has a pancreas cyst, send him to a surgeon, send him to a GI doc. Who do you send the person to? But then, because we've had a few such incidences where we found that pancreas cysts turn into inoperable pancreatic cancer, we thought it's best to start a pancreatic cyst clinic. And the whole idea of starting a pancreatic cyst clinic is early detection of pancreatic cancer. Pancreatic cancer is going to be one of the highest causes of mortality, cancer mortality, by 2030. At least that's a prediction.
Yes.
So we want to start now so that by the time it's 2030, we have some handle on the situation.
Yeah.
At least we can provide some help to some people. So the whole idea of your Chai Time Radio talk here for us is to come and spread awareness of this.
Yes.
That's
Yeah.
why we're here.
Thank you so much for it.
Yes.
So you mentioned Methodist. So how would one get referred to a pancreatic cyst clinic at Houston Methodist?
So, generally speaking, I want to just go back a little bit, just to piggyback off of what Dr. Saharia mentioned. A lot of these pancreatic cysts are found on like incidental findings, which means you go into the hospital for anything, abdominal pain, something.
Right.
A scan is done of your belly, be it MRI or CT scan, to find out what's wrong with you. And sometimes they do find that. Symptoms, a lot of times it doesn't have symptoms, but it could develop symptoms, which the symptoms are pretty close to what you would experience with pancreatitis.
Okay.
So with that being said, it causes a lot of misses. You're not here, that's not what's bothering you. It's a tiny cyst. We forget about it. You fall through the loop. And so that's a lot of what we're seeing. And I would imagine for the patient that he described, that's probably what happened.
Yeah.
A cyst that had developed years ago, wasn't followed because it was very tiny, was in the body, grew over time and became cancerous, and now inoperable, untreatable. So yeah, these are some of the things that we need to pay attention to. So we're raising awareness to that to kind of streamline, if the person has a cyst, you don't know what to do as a provider, or you could just refer them, or, ask the patient to call the clinic so we can at least keep an eye on it. Sure, it might not be, cancerous or anything like that, but we want to watch for the growth.
Yeah.
We want to test it. We want to see what's going to happen in the future. At least trend it, follow it, so that the patient doesn't develop any kind of issues in the future. Yes. I'm sorry, I missed the question. I forgot the question really quickly.
I was just asking, so how would one get referred to a pancreatic
Yes.
cyst clinic at the Methodist?
So Methodist, a referral, the number is for the clinic would be 713-441-1009. We accept referrals from physicians through our MAR system, which is the electronic medical record system, which can send directly through it. Calling this number for the clinic would, create a trace, and we would be getting the referral through there. Okay. So these are some of the ways. I've had patients call themselves, and I've had physicians call. Those who have access to our electronic system can also shoot an email or a text message, something like that.
Okay.
Yes. Mm-hmm.
So now, if someone is experiencing cystic, what signs should they watch out for that might indicate a problem with their pancreas?
Okay, so again, the symptoms are very vague, and it will be related to somewhere in the abdominal, cavity. Most people experience abdominal pain, which could be an indication of an inflamed pancreas, pancreatitis, either chronic or acute. Nausea, vomiting is a common thing for, inflamed. But again, nausea, vomiting, very vague. We don't really know what's going on, right? So new onset of diabetes, especially if you've never had like a family history of it. Your mom doesn't have it, dad doesn't have it, doesn't exist in your family. All of a sudden you have diabetes, especially at a young age or an older age. You haven't had it, but in older age you have it. That's something to watch out for. Jaundice, it could indicate like a blockage in the pancreatic main duct. So that's another thing. So pile up of bile in there. Okay, so that's some of the things that we look for, and especially unexplained weight loss. Nothing has changed in your life. You're not trying to lose weight and you lose a whole bunch of weight. So these are some of the things that would be. So it'll probably be one of the differential diagnoses that we want to look for. Look at the pancreas. What's going on with that? We'll test enzymes to see, I mentioned before, lipase, amylase, protease, to see if there's anything that's lacking there to trigger, okay, this might be pancreas.
I wonder if there's like some kind of, I'm sure you know this, but blood work or something that you can do that tests all of your systems, like everything, like health check basically.
Generally, generally it's like a liver panel that tests liver panel, right?
Liver panel. Okay.
Yeah,
Yes.
Honestly, we're not there yet. So we there is no magic one test that we can do which can say that this is exactly what the person has.
Yeah.
So a lot of times these cysts get caught accidentally on a scan done for something else. So, but that's why we've managed to, like for example, the patient I mentioned earlier, that guy was getting scans done for his prostate cancer, and this was just incidentally caught. So that's the unfortunate thing. We don't have a way to tell a person if they have pancreatic cysts or pancreatic cancer just by some blood work.
Okay.
Yeah. And no one at this time recommends doing routine CAT scans or MRI scans just because they want to rule out, hey, I'm afraid that I just want to do a routine CT scan on myself because I want to make sure I don't have any cancers inside me. Those recommendations are not out there yet. But if there are scans that come tomorrow which do not cause real problems, like for example CT scans, MRI scans, they're not just simply benign. They give you some amount of radiation. MRI scans don't, but they're uncomfortable. You're sitting in the machine for about an hour and a half. It costs anywhere between $1,500 to $5,000 to get these scans done. So I cannot imagine any insurance company agreeing
just
with that,
just routine, right?
Yeah.
So it's not something. I may want a scan, but sometimes you'll pick up stuff that you don't want to see.
Yeah. And I think that's the mindset of especially like the South Asian community, right?
Yeah.
I'm not feeling anything. I'm fine.
Yeah.
As long as there's no pain, I'm okay. But like even with diabetes, we don't know what's going on inside our bodies until we actually go get checked. And a lot of times we don't want to go get checked because we're afraid. We're like, no, I'm okay. Like nothing's wrong with me. And then it gets worse.
Mm-hmm.
And that's when we're worried.
100%.
So, how are pancreatic cysts typically detected? Are they found during a routine checkup or through imaging or unrelated?
So, like Dr. Saharia mentioned, a lot of them are found on incidental finding, which means they go in for something else and they find it. Generally speaking, it will be through CAT scan, which shows, a pancreatic cyst, MRI, which can differentiate between what kind of cyst it is. So these are some also the tools that we use to try to, figure out what's going on with the cyst if a person does develop a cyst. Yes. Mm-hmm.
Okay. And what makes the Pancreatic Cyst Clinic at Houston Methodist unique in approach to care and treatment?
So again, what we were saying before is there's no specific way. People don't really have a streamlined way of sending patients to a certain specialist to look at it. So there's a need for that. It's why the clinic was built or developed in the first place. So with the Department of Surgery and the Underwood Center, we've been able to, build a clinic that's going to streamline patients to there. So its uniqueness, it's really, that's our focus.
Yeah.
That's our specialty. That's what we want to, follow. So once we get the patients in, we're also discussing it with a team of multidisciplinary doctors, compromise of radiologists, oncologists, surgeons, who will say, okay, these are the best evidence-based protocols to treat this type of cyst once it's developed. The other thing is too, we're working very hard to find molecular testing, which means genetics testing really, to see if this particular kind of cyst that the person has is going to develop into something cancerous in the future. So we're not leaving it to chance. We're testing to see what's going to happen in the future, or if there's a likelihood of something happening.
So situations like the doctor mentioned would not occur, or
Right.
potentially not occur.
Yes.
If given to the right department. Yeah.
Yes.
Yeah, that's great.
We just don't want the patients to continue falling through the cracks. Following them, inviting them, having a protocol that actually invites them. Hey, come back in 6 months. Let's check it out. Hey, come back in a year. Let's check it out. You know, is it growing?
Yeah.
Not left 5 years ago and then it just develops into something.
I think that's the real value of this clinic is that there is one place that people can go and get their scans done, because sometimes if I have a pancreatic cyst and somebody told me, hey, you have a pancreatic cyst and get a scan done in 2 years, I will most likely forget it.
Yeah.
But Diana will have a system where she can call the person in 2 years, remind them, hey, you had a CT scan done 2 years ago. And sometimes we forget that we got scans done. I have patients walking into the clinic, and I ask them, have you had a scan? And they'll say no. And then I can pull up the scan, tell them you had a scan done 2 years ago. It's like, yeah. Then suddenly you jog their memory a little bit and they'll come back to them. So that is the value of the clinic, is that there is somebody who's actually looking out for you to make sure that these don't fall through the cracks.
That's great.
And then there are protocols that are out there which can be followed. CT scans, MRIs, biopsies, just ultrasound, endoscopic ultrasounds, and we partner with our GI doctors. So Methodist also has a big endowment by something called an Underwood Center, which is a GI center. So Underwood Center is a big GI center that really covers a lot of us, including Diana. And essentially, within Methodist, it's under the auspices of the Underwood Center that we are trying to run this clinic to just basically help early detect pancreatic cancers.
Wow.
Yeah.
That's great. Well, there's somebody watching out. So
Yeah,
Yes.
that's a great thing.
Diana is going to
Yes.
be the one. Yeah.
Watching out and looking, and looking out for it, make sure it doesn't develop into anything that's catastrophic in the future.
Absolutely.
Yeah.
Yeah, that's great. So we're going to take a real quick break. When we return, we'll continue with our conversation. You are listening to 103.5 Hum FM. Welcome back to 103.5 Hum FM. For those of you that have just tuned in, we are in conversation with Dr. Surya and nurse
Diana.
practitioner Diane Appou.
Yes.
So we are speaking about pancreas health. So before we went on break, I wanted to ask you a question. Are there certain groups of people who are at risk for pancreatic issues?
I would not say certain groups of people as far as male, female, although mucinous cystic neoplasms, MCN, are usually found, it's a type of cyst, they're usually found in women. However, generally speaking, no. I think the risk factors really come in with the type of lifestyle and habit that you have, the smoking, the drinking, obesity, how you eat, how you keep your lifestyle. And so that's what I would say. Not necessarily, males get it more than females. No.
Okay. And what lifestyle habits can help keep the pancreas healthy, and are there specific foods or behaviors that make a difference?
Working out, keeping the good body fat percentage, low body weight, right?
Okay.
Not drinking, especially binge drinking, everything in moderation.
Yeah.
Low-fat diets generally do help. Low-carbohydrate diets, so well-balanced meals, I would say.
Yeah.
Yes.
Yeah. Eat your carbs, eat your proteins.
Eat your veggies.
Eat your veggies. Yes.
Yes.
Have a healthy. There's Linlin always tells me about this magic plate, and I actually ordered one off of Amazon. And this magic plate has where it kind of sections out where you have your veggies, your amount of protein you need, and my mother-in-law is
well portioned
for her. And
yes.
Well portioned. So
yes.
I feel a lot of people like kind of visually need to see it rather than, you know, okay, yeah, I would have more carbs on my plate because I love carbs. But yeah, so it's a good tool.
Balance, yes,
Yeah,
yes,
yeah.
yes.
Okay, so how does that what you eat impact pancreatic health, and are there foods that are particularly good or bad for the pancreas?
Again, well-balanced
Yes.
diet, but I will say we have to pay attention to the sugars that we're eating. As you know, like I was saying before, the pancreas does secrete hormones, which is glucagon and insulin, and also other enzymes, lipase, amylase, protease. So it aids in digestion, and that's its main function. I believe that not stressing these, the pancreas is the main way of keeping the pancreas healthy, which that's why I keep going back to the,
Yeah.
the balanced diet.
Yes.
You can't just eat carbohydrates the whole day, your sugars, your,
no chocolate cake.
Well, you can't eat chocolate cake the whole day. That's going to produce an over excess or, stress to the insulin hormone, pancreas producing the insulin hormone. And of course, things that we need to watch out for, high, carbohydrates, sugars, because they break down into sugars.
Right.
I would say anything, any protein is always good.
Yes.
However, excess is not. We could also say fats, same thing for the fats, because there are hormones that are regulating these things in the body. So an imbalance of, which means you're eating more from one thing than the other, could cause something like that. Yeah.
So, there's like all these fad diets, like people are doing intermittent fasting, and there is high protein and only protein, then there's keto, there's paleo, there's, I can't think of any more. That's all I got. So there's all these kinds of diets that people are doing. What are your thoughts on that? Like, are those okay? Like, especially like intermittent fasting, that's such a big thing right now.
I've read articles about intermittent fasting that have shown that they're good, but I'm not really, I don't have a lot of experience with it, so I don't really know if it's a no or yes.
Okay.
Some people say it does help. Some people say it doesn't. It's not like it's a abundant amount of studies that prove these things.
Yeah.
But I have read 1 or 2 articles that say it's good, especially in blood sugar regulation, because nothing is touching your stomach. And so, you give your body rest.
Yeah.
And then bounce back. So, yes.
Oh.
Well, yes.
We could, I mean, like, it's actually, I think, a good thing, because you give body a chance to kind of rest. And, we have abundance of food in today's day, and we have food sitting in front of us everywhere.
Yeah.
And it's so natural for us to go and snack. I go home, the first thing I do is walk into the pantry. I think it's wrong, but it's just a lot of mental restraint is what I guess helps us lead a healthy life.
But technically, aren't you, when you're sleeping, you are fasted? So if you stop your meal at 6 in the evening and
it's
don't
the
eat
easiest,
till 9?
sleep is the easiest way to fast.
Right.
Yeah, exactly.
So I guess the thing with
Right.
The thing with intermittent fasting, I think, is just prolonging the fast to prolong the body's rest of processing and releasing all these hormones and enzymes. Again, articles do say that it helps.
Yes.
So yes.
I mean, I for one did intermittent fasting for a
Did it
long
help?
time. It did, and then it stopped because
You built tolerance.
I believe
Yes.
so. So now I just eat my dinner by 6, and then I won't eat until maybe 8, 9, 10.
So everything you do, not in excess, I would
I think
say.
a
Not in
chance for
excess.
all your body cells to kind of recover from, just rest a little bit.
Yeah.
So
Yeah, I
That
believe.
makes sense.
I think that's the best way
yeah,
for me. It works for me.
it may not work for weight loss, but I think it's great for the body's health.
Yeah.
Because weight loss is a complex thing, but I think it's still great for the body to do intermittent fasting.
Just give the gut
Back
some
then
rest.
They didn't have food to have,
Yeah.
right? They didn't eat. They
Right.
had one meal maybe.
Exactly, and then
So-
you were to go and hunt for
Gut
cigarettes.
Exactly. They were healthy and I don't have a word. But so we keep touching about alcohol and smoking,
Yes.
and they're often linked to health issues. Do they increase? Well, we know they increase the
Likelihood.
of pancreas problems, right? Do you want to elaborate a little bit more on that?
Well, I would say smoking, in excess. We've known and had studies all over since, smoking became something that we're talking about, it's not a good thing, that it does affect and predisposes you to all kinds of cancers. So that's one of the things that we need to prevent doing. Alcohol, basically, and like I was saying before, binge drinking especially does stress the body, which means producing of excess hormones and digestive enzymes to break down the alcohol. I would say particularly that alcohol, causes chronic pancreatitis, acute pancreatitis, puts the body under a lot of stress, affecting the pancreas. So I would say yes, those are the main things that we need to watch for, especially binge drinking, smoking. Could keep a stop to it. Now, some people could have like hereditary things that affect them also. Some things that could affect the pancreas, I would say, it's just some people are born with a hormone, with a genetic predisposition to certain things, which mean cancer. That's why the genetic testing. And also, I would say certain disease conditions that stresses the pancreas, like cystic fibrosis. So that's one of the things. I believe some viral infections could stress the pancreas, like mumps, but we have, vaccines for it today. So that's less and less of it that we're seeing. Yes. What would I say also really stresses the pancreas? Gallstones, I mentioned that before, could cause a block to the pancreatic main duct, which causes pancreatitis, stressing the pancreas. Pancreatitis is generally an inflammation of the pancreas. So, those are some of the things that we kind of watch out for. And of course, trauma. Unfortunately, people get into car accidents or somebody, and so that could affect the pancreas, depending on what organ that is, that could cause that.
One thing I suddenly remembered, high triglycerides. So if somebody has very high triglycerides, so that's one of the lipid panel things that we check is HDL, LDL, triglycerides, cholesterol check. So triglycerides is one of the components of the cholesterol checking. And high triglycerides are associated with pancreatitis. And when somebody has chronic pancreatitis, they're basically being predisposed to pancreatic cancers.
Wow.
So triglycerides is one blood test that you can do, which can tell you if you'll be predisposed to chronic pancreatitis.
Yeah.
We don't even look at these things.
No.
We don't even ever think about that simple thing as checking your cholesterol could potentially give you
insights into
those three combinations when it comes to high cholesterol, diabetes, and increased body fat. Those are, a combination that really, disseminates into a lot of disease processes. And so once you have those three things under control, I think you'll be in a good, protecting the heart, protecting the kidneys, protecting the pancreas, all kinds of organ systems. Those three things, yes. I would also want to mention, I'm sorry about that, medications. Some medications do cause pancreatitis, and some antibiotics, some steroids cause pancreatitis too. So, yeah.
That's interesting.
Yes.
The weight loss drug,
semaglutide,
actually cause pancreatitis.
GLP-1s.
Whoa. Wow.
Yeah, the studies out there, that's one of the blood warnings that we see.
Ozempic is a magic drug.
Yes.
You have to be careful.
That's crazy. We don't even think about once the doctor tells you, okay, you know what, you get on this, you want to, be your healthy version, but then there's side effects to even the thing that you're trying to get healthy for.
Side effects to everything. Crossing the road has side effects.
I'm just mind blown right now. So we mentioned about smoking, right? So what's your view on vaping? Does that have the same effect as smoking to your pancreas?
Honestly, I don't know, but vaping itself.
Vaping is healthy.
It's not.
Vaping is horrible for the lungs. So it can result in a lot of lung issues. But specifically for the pancreas, I'm not sure. Honestly, all I know is that pancreatic cancers. When we see somebody with a pancreatic cancer, a lot of patients have history of smoking for a long time. Yeah. And alcohol use is also common in our patients who have had pancreatic cancers. And family history of pancreatic cancer is also actually fairly common. So we know that if 2 of our blood relatives have had pancreatic cancer, our risk of developing pancreatic cancer is pretty high. So those people who have had pancreatic cancers in their families, they need to actually go through proper surveillance. I would say those people will need follow-up CT scans just on a regular basis, so that because if we can detect it early, we can actually
treat it.
truly act on it. But one thing that's horrible for pancreatic cancer is detecting it late.
So what can people do to detect it early?
Especially, those people who have, say, BRCA mutations or family history of pancreatic cancer, they should get CAT scans done on a regular basis. But like somebody who does not have family history, who's not smoking, and we don't have any like solid recommendations as to go and getting scans done on a regular basis. But I'm hoping, a few years from now, there'll be some scans that you walk in like when you go in through the airport security, they have systems that can actually scan you in like 5 seconds. I hope that somebody comes up with a system which can actually quickly look at stuff that can
Scan the whole body for everything.
That are out right now. I keep hearing it on the radio, where you can get your heart scanned.
Yeah, that's a CT calcium score. It's
Okay, and
actually
they can see if there's any cancers or anything like that in your
not
body.
cancer.
Or
Not cancer. The
Okay.
CT calcium score is how much calcium you have in your coronary arteries, and that's a
Okay.
great way to predict
Heart attacks.
heart attacks.
Oh,
Yeah.
okay. Wow, that's
Basically,
interesting.
your heart health.
Yeah, heart health. It's a very quick
Yeah.
scan, and they're not giving you any IV dyes or anything, so you're not likely to get any reactions to iodine that you get otherwise.
Okay.
And you go in 5 minutes, because that's all it takes, and insurance pays for it. If you have family history of any cardiac disease, or you're got metabolically inclined to develop coronary artery disease.
Wow.
So.
I feel
that's
like after this show, instead of going somewhere else, I'm going to go straight to
It's like, don't eat. Don't eat ever. No.
go get myself checked.
Yes.
So how are pancreatic conditions diagnosed? Are there early screenings tests available?
The early screening tests, not really, not that we know. But again, if it's found incidentally, then it can be followed if the patient is directed to the right provider to follow it, right? Other things that we use to screen for cysts or if they're growing is CT scans,
Right.
like we talked about. Those are provide detailed images of pancreatic of the pancreas to identify cysts. We also have MRI scans. They're more clear images that differentiate between what kind of cyst we're looking at. Is it benign? Is it malignant? We also have EUS, which is endoscopic ultrasounds. They usually allows for close examination and possibility of obtaining like cystic fluid to test it.
Okay.
Okay. And then we have MRCP, which is magnetic resonance cholangiogram. Pancreatopathy. I hope I'm saying that right. MRCP, specifically useful in assessing the pancreatic cyst and the duct of the pancreas to make sure.
Wow.
Yeah.
Okay.
Yes.
And what are current treatment options for pancreatic disease? Are there any new advances or promising research?
Treatment options generally would be pancreectomy, taking out the pancreas using surgery, EUS, which could test or drain the pancreatic cyst, should I say? So drainage of the pancreatic cyst, removal of the pancreas.
It's got the chills.
Well, it'll be under anesthesia, so.
Okay, good.
So drainage of it. So those are the two. Anything else?
No, there are actually. There's a lot of research out there, but unfortunately, we don't have great treatments for pancreatic cancers right now. But we have developed, we have protocols that basically can say, okay, this chemotherapy regimen is better than this chemotherapy regimen, and keep doing chemotherapy before surgery or after surgery, and timings and whatnot. But I know that there is a lot in the offing. They're doing a lot of basic science research, and they're trying to come up with targets that can identify pancreatic cancer specifically and create medicines that are very targeted medications and not like chemotherapy that basically throws medicine throughout your body. It has its value. It has great value. If cancer is spread somewhere else, then it's a great value of getting it from wherever it's gone. It's a great value in reducing the size and helping us live longer. but pancreatic cancers and chemotherapy so far has not matched too well. We have response rates of only 30-40% in our patients. Unlike breast cancer, you give chemotherapy in breast cancer, you don't even know where cancer went. It just vanishes. Colon cancers, you can give chemotherapy, colon cancer just vanishes. In melanomas, you used to have trouble. Now with immunotherapy, melanomas vanish. But we haven't quite achieved that in pancreatic cancers. So that's why whatever efforts we are making efforts to identify it early, so that shortcoming that we have right now is of not having any true treatment, no great cures for pancreatic cancers. We want to detect it early so that we don't even get to that where we are struggling about outcomes and mortality and whatnot.
So surveillance.
Yeah. Well, I mean, if I had it all on me, I would say get a scan done for everyone. But somebody's going to
pay
put me
for
in jail
it.
for that.
Yeah, exactly.
So I had a quick question.
Yes.
Yeah.
Are pancreas transplantable? Like,
Yes.
Yeah.
Oh, they are.
Pancreas is transplantable, but not after it has developed a cancer. So we do pancreas transplants for people who have type 1 diabetes. So what is type 1 diabetes? Type 1 diabetes is usually childhood diabetes, which people have developed in their young age, like in teenagers or even younger. And that's because the pancreas got destroyed by a virus or something caused the pancreas to completely stop working. And those patients lose their pancreas ability to make insulin. So typically these type 1 diabetics have really high blood sugars when they're in teenagers or early adulthood. And those are ideal patients for pancreas transplant. But once you've developed cancer in your pancreas, you cannot really get a transplant. The reason is that the immunotherapy medications, immunosuppressive medications that we use for pancreatic cancer, they have a tendency of causing cancers. So you cannot give a pancreas transplant to somebody and give them immunosuppressive treatment, because then that'll increase the risk of developing cancer. So that's why cancers and transplants for pancreatic cancer especially doesn't happen. But for liver cancers it does, because that's a different cancer. And for liver cancers we do liver transplants, but not for pancreatic cancer. But that's a great question. That's a great question to ask.
So, where can listeners find more information about pancreatic health, and are there resources or organizations you recommend?
Yes. So the Mayo Clinic has a lot of information online about pancreatic cancer and pancreatic cyst. Of course, journals and articles, peer-reviewed journals and articles. Okay, just not something you found on Google per se. No.
Okay.
It has to be peer-reviewed journals and articles. Has a lot of information about it. So yeah. Any other resources you think?
Honestly, the best place to go is American Cancer Society. They have a lot of information on pancreatic cancer prevention and details of that. I would say that will be a good place to go, and basically peer-reviewed journal articles that are out there. That would be the best place to go if somebody is really looking for details into how to prevent pancreatic cancers. But there's no true prevention of pancreatic cysts. It's, if somebody develops cysts, they have a tendency to have them. And if you have them, you just have to do surveillance for them. Surveillance is in the form of CAT scans, EUSs, and biopsies, and some molecular testing, which is actually pretty fancy stuff. Molecular testing is a way in which we can aspirate, that means pull out some fluid from the cyst and send it for genetic analysis, and they can predict with pretty high accuracy whether this is going to turn cancerous or not.
Oh, wow.
But those tests, with new Medicare ruling and whatnot, it's going to be harder for us to order those tests.
Yeah. Ugh. So, any final messages for our listeners about maintaining a healthy pancreas?
I would say I want to reiterate the things that we've talked about again: diet, preventing high lipids, high sugars, diabetes. not smoking, maintain a good lifestyle, eat well, balanced diet. Those are some of the things that in general, just the body health in general, the less the body's inflamed, the more you can prevent all kinds of disease processes, including pancreatic cyst and pancreatic cancers. So that's what I want to really drive home, being healthy.
Yeah.
Being healthy. That's one of the things.
Eat well and exercise.
Yes. The other thing would be, I would advise, just read your imaging when you get it done, just in case the physician that's ordering it says something about the pancreas area.
Yeah.
You could ask about it. Hey,
Right.
doctor, what does this mean?
Yeah.
Should I get it surveillance? Should I call? Is there a specialist that can look out for it? I know it's nothing, right now because it's small. Is there a potential that it could develop into anything else? Who can I call?
Ask questions.
I
Ask
think that is
questions.
the most important thing.
Ask
Just
questions. Who can I
just
call?
Don't depend on your doctor or your
Right.
physician or whatever
Right.
to notice everything. Take responsibility of your health. If you see a scan which says a pancreatic cyst, do ask your doctor. Read your scans, read your reports, see what it shows. Be inquisitive about your own health. If you get a blood test done, just don't sit down and think, oh, well, the doctor hasn't called me back, so it should be okay.
It's high. What does it
Yeah.
mean?
Say,
Yeah.
I have a
And that's
problem
a lot
with
of
it.
times
Yeah.
we do that. Because
Yeah.
we don't, the doctor's told us enough, we don't
Yeah.
need to look into it.
Pull up your report. I do that to me. My doctor doesn't call me back, so I was like, I'll look at my report myself.
Yeah, that's
So I will look at my report myself and I'll say, okay, there's a problem here, or at least this shows up in red, and I better be calling and finding out. Take out
Yeah.
time to take care of your
Yeah.
health. Yeah.
Yeah, that's amazing. Well, thanks for joining us today. I can't believe that an hour just went by. It's crazy. We hope that our listeners learned something important about taking care of your pancreas. And stay tuned for more healthy tips on Chai Time here on 103.5 Hum FM. Thank you both for joining us.
Thank you for having
We
us.
love the ample amount of information you've shared with us. I'm taking back, eating healthier. I don't drink or smoke, but eating healthier and just taking care of my health is, crucial, right? So
Yes.
Thank you both so much. I really appreciate you guys coming on our show. I'm sure we will see you again.
Yes.
And I hope you guys had fun as well.
Yes. Yes.
Thank you.
Thank you. Thank you.
Thank you, everyone.
Thanks for having
Bye.
us.